And I'm aware that you utilize BioMin in your whitening treatments. Can you please expand on this and the results?
Yeah, so I mean, every patient who whitens, it's not that I warn them. I tell them now, you are going to have sensitivity, because it's 99% of patients will have some mild sensitivity whilst they're whitening, and some will be very severe. And I personally don't think it matters what whitening gel you're using, or whether it's had any potassium nitrate incorporated or anything desensitizing agents. It still will cause sensitivity. So what I've started to do is I recommend patients use BioMin 2 weeks before they start whitening. So when I take the impressions for their whitening trays, I make them by BioMin. They start using that twice a day as their normal toothpaste. And then they go to start whitening 2 weeks later. And I recommend that if they can whiten and they're okay, then continue. But if they have a lot of sensitivity or they're finding it really uncomfortable, then to take a day off and put BioMin toothpaste inside their whitening trays and sleep with that overnight, and then switch back to whitening. So I've had a few patients who go every other night with toothpaste and then the other night with whitening. And it means that it's achievable for patients, because what I hate the most is patients who they start whitening and then day 3 they stop because it causes too much sensitivity, and then they throw away their trays, and they lose their trust in you, because they're like, well, you didn't tell me it was this bad. And so with this toothpaste, it really, really works. And patients are, patients who specifically, for example, Invisalign patients who have a lot of sensitivity because they're in the middle of orthodontics or teeth alignment, it works fantastically for them if they want to whiten afterwards too.
Yeah. And you have a case here that we're going to share on the screen. And could you speak a bit about the case?
Yeah, so this patient, she always has suffered from severe sensitivity. She's got tooth surface loss. I mean, you can't see her molars in this photograph, but she's pretty much lost all of her enamel on her molars. And even on those incisors, you can see on the top that they're very thin enamel. And the teeth don't look strong, if that makes sense. So she came to me, we did Invisalign for her. So we straightened her teeth, and then we wanted to whiten them. So I did exactly the same protocol. She'd used BioMin 2 weeks before. And then she was experiencing severe sensitivity while she was whitening. So she did every other day, toothpaste and then whitening, and then toothpaste and whitening. And a few weeks later, these were the results, which I think are fantastic. And what she said, quote unquote, was that her teeth look and feel younger. And you can really see it in the photograph that it's not only that the teeth are significantly whiter, but the actual kind of texture and the actual look of the tooth has changed. It looks a lot stronger, a lot more mineralized. There's no see-through anymore. And it's actually amazing how it's worked. And she loves it, and she continues to use it after her whitening.